Hello, and welcome to Stay at Work, Return to Work Program, Mini Module 2, Program Elements. This is part of a three-section presentation on Stay at Work, Return to Work. If you have not completed Mini Module 1 overview, you can do that before proceeding with Mini Module 2, Program Elements. This presentation, we will be covering the legal obligations of Stay at Work, Return to Work programs, Stay at Work, Return to Work program element regarding direct access relationship to physio and chiropractic clinics, as well as how a Stay at Work, Return to Work program works. So there are some legal obligations through WCB on return to work. So organizations with 20 or more employees are required to offer the reemployment provisions or follow the requirements of the reemployment provisions found in Section 89 to 101 of the Nova Scotia Workers' Compensation Act. To reemploy an injured worker after a work illness or injury. An organization has a legal obligation to employees who have at least 12 months of consecutive employment prior to work illness or injury. The responsibility extends to 2 years following the work injury or illness. In Section 5, Part 1 of the Nova Scotia Human Rights, organizations and its employees shall not be discriminated against for any injured employee, as well as no person in respect of employment shall be discriminated against an individual or a class of individuals or an account of a physical or mental disability. So when we look at some of the program elements, one of the most significant program elements, and it's had a dramatic effect on, a positive effect on the Stay at Work, Return to Work program, is the direct access relationship with physio and chiropractic clinics. An organization is encouraged to establish a direct access relationship with one or more physiotherapists or chiropractic clinics that are approved by the Workers' Compensation Board of Nova Scotia. Developing those relationships really helps make for quick and easy access to developing a return to work plan that works for both the employee and the employer. This will ensure that the employees experiencing uncomplicated sprains and strains injuries have access to functional scans, assessments, and treatment services quickly. It's beneficial to both the injured employee and the organization as it helps facilitate early, safe, and effective safe and return to work planning. And if you build this relationship with an organization, they understand the type of business and the type of work you do. So in some rural areas, there may not be a lot of options, but where there are options, building those relationships is crucial. And some organizations, even if a worker chooses to receive treatment at a particular or a physio clinic, they may still have the employee go to a physio clinic to have the assessment done, the functional scan, where they understand the type of work and the requirements that that job entails. A lot of these physio clinics will visit the workplace pre-injury when you're building that relationship so they understand the type of work that's being done and the abilities that a worker must have to do various duties. An organization should ensure that they've established a process to help ensure that the clinic provides them with the capabilities they need. And that's a lot of what I talked about, is with them coming to visit and understanding what their physical requirements are and what the work environment is like. And when people can actually see the type of work being done, it helps them be better providers, I think, to ensuring an effective stay-at-work, return-to-work program. The organizations are also encouraged to create a performance measure results for each of the physio or chiropractic clinics they use, that they have a direct organization with, and a lot of times these are reports are sent on to their senior or executive management team. All employees at all levels are to be fully aware of the goals of the return to work policy and the roles of the direct access relationship and where that falls in the overall plan. Information about your direct access relationship should be provided to all employees and supervisors, and employees and supervisors must be made aware of how employees with uncomplicated sprains and strain injuries should be referred to these clinics. And this is where, this is a general overview, so it's good to look at your policies and procedures and to understand how that process works in your organization and who you have the relationships with, what clinics you may be attending. Injured workers do have the right to visit their family physician, but they do not need to see their physician before accessing or going to a clinic, and you should try to get to a clinic in a very timely fashion. However, if an employee hasn't seen their family physician and they're still required to go to the physiotherapist or chiropractor who has been approved at an approved clinic by either their request to go either by the request of the organization or by WCB. First impressions are vital to the success of a stay-at-work, return-to-work program. The experience that employees have, how they're treated immediately following an injury, has some very significant implications on the success of the program, the worker's mental health, and how the worker is committed to their workplace and the program. So it's always, when an injury happens, it's disruptive for everybody, for the organization, for the supervisor, and most importantly, the employee. And they are most affected just inside and outside of the workplace. So we need to keep that in mind as we go through the process. And if your process is well-defined and everybody understands what the process is, this will keep sort of everybody focused on what needs to be done and be as positive as an experience as it can be in the light of somebody has received an injury. So early experiences, especially supervisors' reactions, really help make this process run smoothly, and the worker is going to be more likely to work with supervisors and the organization that is really trying to establish a good and fair return to work plan. Supervisors and workers both need to have confidence in the program. They need to understand that it's fair, supportive, and it's in place to promote recovery, and that the steps have been taken to prevent injuries in the future. Well-established, well-implemented stay-at-work, return-to-work programs that are managed by employers, and where the supervisors and employees are actively involved, has shown to reduce the duration, saves money, and helps improve employees' perception of the employer. Workplace contact with the injured worker is vital. It should be structured, and it should be planned, and should be well communicated. So With any injury, sometimes when the injury happens, the immediate supervisor may not be available. It's really important that the supervisor makes the contact with the employee, and whoever's going to be managing the claim as far as setting up any physio appointments or filling out WCB forms, however that works within your organization, all that communication needs to be communicated to both the supervisor and the injured worker. The healthcare provider and their role in this is very important, and there needs to be somebody who's going to coordinate the overall return to work, stay at work program. This won't be WCB. This will be somebody on the work site, although WCB will be a very important player in this as you go through this process. And the employer needs to appoint somebody who will be the point person on this program, on any return to work plan. So how does this program work? So this program is really broken out into 5 steps. Step 1 is the initial reporting of the incident. Step 2 is the assessment. Step 3 is the development of a return to work, stay at work program. Step 4 is the establishing the plan. And then step 5 is where we all want to get to, which is returning to full duties. We're going to go through each of these steps in more detail. When we go through these steps, we'll be flipping back and forth between what the employee's responsibilities are and what the employer's responsibilities are. And again, these are general overview. You in your policy and program and your procedures will have more detail around specific roles and responsibilities. These are just general ones related to the program. You'll see we have it broken out into work-related and non-work-related. And that's for those organizations that use their stay-at-work, return-to-work program for non-occupational illness and injury, may use a lot of the same elements. So we will, on occasion, through the next part of the orientation, discuss return-to-work, stay-at-work programming through the lens of non-work-related injuries. So the initial reporting. So when an incident happens, the most important thing is to get whatever first aid or medical treatment's needed when it's a work-related injury. And then as soon as safely possible, report it to the supervisor, his or her supervisor, and do that in whatever means is acceptable within your organization. So whether it's in person, via the phone, voicemail, email, whatever that is. For non-work-related injuries, the employee should notify his or her supervisor and if any absence due to a non-work-related issue that could hinder their ability to do their job. So again, whatever reporting methods are in place for your organization, that's what you need to follow. For that first step, for supervisor's responsibility, for a work-related injury, the supervisor should ensure that the first aid or medical treatment has been provided or arrange for them to be transported to a hospital or medical facility if emergency medical treatment is required. A lot of organizations, the next point is to send an information package. So a lot of organizations have established these return to work, stay at work packages, which will include a letter to the physician or the medical professional that says that the organization participates in a return to work program. It'll have abilities forms in it and any other information about the requirements to perform that duty. Having these packages readily available for supervisors to give to workers helps move this program along quite quickly. For non-work-related injuries, confirming within what's not so much what the illness is or the reason for the absence, but really focusing on the ability or what they may or may not be able to do. And remind them if you have a return to work, stay at work program available for non-work related injuries, that you share that, and that if the absence is related to other common illnesses, cold and flu, that those are notified through the normal resources. For step 2, for the employees' responsibilities of assessment, attending all physio and chiropractic clinic appointments, as well as any other applicable medical appointments and or treatments, perform all necessary exercises, tests required by the physiotherapist or the chiropractor, ensure all necessary documentation is given to the supervisor or the designated person who's managing the claim, and where applicable, to the WCB case manager. For the supervisor or designate, and going through this, when I use supervisor, it could be supervisor or designate, whoever's helping to manage the program or carrying out these tasks. Ensure that the organization's internal incident report is completed, as well as the WCB report form is completed. And it's sent to the appropriate person, whether that's inside the organization or whether you send it on to HR for them to send it to WCB. Make sure that the employee is sent to a chiropractic clinic or a physiotherapist for the direct access functional scan. Once you've received the physical abilities form, or the functional scan, or any other medical documentation, to determine whether or not the employee can perform their regular duties or needs transitional duties or is not capable of working at that time. So it's usually one of two things happens. Either yes, they may have been injured, but they're still able to carry out their regular duties, so they just return to work, and you just monitor that for whatever process is acceptable for the injury that's occurred. Many times there needs some transitional duties, so some modifications, so they may not be able to lift as much weight, they may not be able to stay and sit for the same time as they normally would, and then in some situations they have to be off work for a time to do a certain amount of recovery before they can then go into using transitional duties. When it's determined that the employee is capable to perform transitional duties, then the supervisor, along with the employee, healthcare professionals, or whoever's involved, to develop that stay-at-work, return-to-work plan. Step 3, in developing the plan, the supervisor will consult with both the employee and the health provider to determine what are the goals of the plan, the milestones as they go along. So many times, because the assessments are typically, the functional scans are typically done every 2 weeks, usually there's a plan set out for a person to work at a certain capacity for 2 weeks, and then they're reassessed and they move on. If they suspect that progress might happen more quickly, they may choose to do the functional scan more often, and usually during this time, the worker is also continuing to seek medical attention from a physiotherapy or chiropractor, so that can be assessed as time goes along. You need to make sure that you get the details around the requirements for the modification or accommodation. So is it modifying the employee's work schedule? So sometimes in the beginning, they may not be able to do a complete shift. There may be modification or elimination of specific job tasks or duties. There may be modifications to the employee's level of performance and output. There may be a requirement for extra tools, equipment in the work area to help facilitate the transitional duties, and what's the time frame and the progress and the appropriate follow-up. And if you really go through and you keep going back to this plan as you're doing this return to work and make the adjustments and the modifications, it really can be quite impactful on both the employee and the employer for a successful return to work program. The employee needs to ensure that they're consulting with the supervisor and their medical provider in the development of the return to work plan, help plan the start date for the implementation, and help identify the restrictions as they're performing these duties and where they were pre-injury. For the supervisor on the plan, determining the limitations of the employee based on their functional abilities and the medical documentation, identifying any available transitional duties that could be used during the stay-at-work return to work plan, identifying any modified or accommodating requirements that would ensure success of the plan and getting the employee back to full duties, as well as establishing a start date and review dates for the program or for the plan. When it comes to implementing, the employee has responsibilities. The employee is expected to perform all duties identified in the plan and ensure they comply with any restrictions and adhere to the identified modifications or transitional duties or accommodations for the duration of the plan. So some of the areas that some employees struggle with is they want to be able to do certain tasks because they like to do it because it's an important part of their job, but the return to work plan says they can't. So it's really important that employees don't go beyond what's laid out because we don't want to have further injury. And on the other side, it's really important that supervisors don't ask employees to do anything beyond what has been designated for them to do in the return to work plan. The employee continues any treatment necessary by the healthcare professionals during this plan, and the employee is advised that the consequences of his or her decision not participating in a program or not participating with medical treatment can result in suspension of benefits from WCB. Supervisors' responsibilities, once again, is to finalize the start date and any determination around there. Make sure that the supervisor submits a copy of the plan to all of the people that are involved, and including the WCB case manager. Monitor and change the plan as required as more abilities become available or the employee is able to do. Communicate with the employee on any issues that may arise on the ongoing implementation or changes to the plan. If changes are necessary, the supervisor, with the agreement of the employee, will make those changes and submit those to WCB. And then ultimately, it's to get to step 5. And it's really for an employee to get to where they were before they were injured and to be able to fully do their job at their full capacity. So I think the most important takeaways from this is to make sure that all the parties stay actively involved, that the workers and the supervisors are aware of what their roles are, and for everybody to remain positive and think about where they're trying to get and be open-minded to trying things that are a little different. And maybe things have to be done a little differently, but it's to the benefit of everyone. And this is the conclusion of mini module 2. If you now complete the post-assessment below the video, you can move on to mini module 3.